I've had Crohn's disease for almost 20 years, and whenever I have a bad flare-up, it can sometimes trigger something called supraventricular tachycardia, which is an extremely fast heart rhythm. I've ended up in the hospital with my heart rate over 185 before, so I know the symptoms pretty well. During one particular flare-up, I started feeling the familiar signs of supraventricular tachycardia. My heart was racing, I was having trouble breathing, and I had that strange brain fog that comes with it. I knew something was wrong, so I went straight to the ER. When someone is having supraventricular tachycardia, one of the medications doctors sometimes use is a powerful drug called adenosine. It works by briefly stopping the heart for a second or two, essentially giving it a chance to reset itself into a normal rhythm. But when it's necessary, it can be extremely effective. If it doesn't work, the next option can be electrical cardioversion, which means shocking the heart back into rhythm. I've unfortunately had to go through the process several times, so I knew exactly how serious it was. There's normally a doctor present, the patient is connected to monitoring equipment, and everything is prepared in case something goes wrong. During this particular ER visit, the doctor determined that I did need adenosine to stop the supraventricular tachycardia. He then stepped out of the room for a few minutes. While he was gone, a nurse came in carrying medication and began preparing to administer it through my IV. At first, I assumed everything was being handled normally. Then I realized what medication she had. The doctor had entered the order for adenosine, and the nurse had simply gone to retrieve it and give it to me. The problem was that she apparently had no idea what the medication actually did. She walked into the room alone and injected the adenosine into my IV without the doctor there. If you've ever received adenosine, you know there is a very distinct sensation when it takes effect. I recognized it almost immediately. I started telling her, "No, wait. You have to wait," but it was already happening. There was no doctor in the room. There was no crash cart beside me. I wasn't even connected to the monitor. She had essentially stopped my heart with just the two of us in the room, and I didn't even have the defibrillator pads attached in case something went wrong. It was one of the most frightening medical situations I've ever experienced. When the doctor returned, I immediately told him what had happened. That was difficult because I was still in supraventricular tachycardia, terrified, and trying to explain that the nurse had already administered the medication. Another doctor or nurse immediately took the first nurse out of the room. I could hear someone outside explaining to her that you never administer a medication without knowing exactly what it is and what it does, especially something capable of causing such a serious reaction. I think she simply saw that the doctor had ordered the medication and assumed that meant she needed to retrieve it and administer it immediately. But that assumption could have ended very badly. I was completely stunned afterward. Even now, when I tell people this story, some have trouble believing it. They usually say that no nurse would make a mistake like that, especially with a medication as serious as adenosine. But it happened. The experience taught me something I'll never forget. When it comes to your own healthcare, speak up, ask questions, and make sure you understand what is being done to you. Being an active participant in your own care can matter more than you realize. I'm an electrician by trade, and for a while I worked at a very large and prestigious teaching hospital that was operated by an equally prestigious university with an enormous endowment. Part of my work took me into the hospital morgue, and I spent several months going in and out of that area while working on different projects. Sometimes I would be there at night, working directly above cadavers that were stored in cardboard boxes. Other times, I would be surrounded by translucent plastic containers holding preserved body parts. It also wasn't unusual for us to have to stop working for a few minutes because hospital staff needed to move a newly arrived body through the area. After a while, I became surprisingly desensitized to dead bodies. They were simply part of the environment I worked in, and eventually they didn't have the same effect on me that they probably would have had when I first started. But there is one particular incident I still remember clearly. One ordinary day, my work partner and I were running conduits through one of the walls of the morgue. Because of the way the job was set up, we were constantly going in and out of the morgue through its single door. In the hallway directly beside that door, someone had left a hospital gurney. At the foot of it was a bundle of dirty-looking sheets. The gurney remained there for hours. We moved it at one point. Hospital employees moved it at other times. People placed things on it and continued going about their work. There was nothing about the situation that immediately seemed unusual. It was just another piece of hospital equipment sitting in a busy hallway. Toward the end of the day, my partner and I were both inside the morgue when we suddenly heard a man in the hallway react with complete disbelief. He shouted, "Who left a dead baby in the hall?" At first, I couldn't even process what he was saying. Then we realized what the bundle of dirty sheets actually contained. It was a dead newborn. That small bundle had been sitting on the hospital gurney for hours, right outside the morgue. During that time, hospital workers had moved the gurney, set things down on it, and walked around it without apparently realizing what was underneath those sheets. That was the part that stayed with me. It wasn't the fact that there was a dead body. By that point, dead bodies had become almost like coworkers to me. I was surrounded by them regularly, and I had become accustomed to the environment. What bothered me was how careless and ordinary the whole situation had become. This wasn't just another body. It was a newborn child, something that represented one of the deepest fears a parent could ever experience. Yet the baby had been wrapped in what looked like dirty sheets and left sitting in a hallway, as though it were an ordinary piece of laundry. And the strangest part was that all of us had unknowingly interacted with it. We had moved the gurney. Other hospital workers had moved it. People had placed things on it. Everyone had gone about their day without realizing what was actually inside that bundle. Even though I had already become accustomed to working around death, that discovery was different. It was the complete lack of awareness surrounding it that made the memory stay with me. About 9 years ago, I spent some time in a psychiatric hospital after dealing with a traumatic brain injury, postpartum psychosis, and bipolar disorder that had become increasingly difficult to manage. My first week there was relatively uneventful. I spent a lot of my time sitting in a chair crying, while my doctor gradually increased the medications I was taking. By the 5th day, I was heavily medicated with Ativan and mostly trying to get through each day. Then the second week began, and a new patient was brought onto the ward. He was more or less dragged inside, and at first I thought I recognized him from somewhere. But the person standing in front of me seemed completely disconnected from reality. He had an intense stare and behaved like a completely different person. Normally, when someone is admitted, the first few days involve meeting with their doctor and the charge nurse, discussing their history, medications, and getting familiar with the routine of the ward. That wasn't how things went with this man. For the first few days, he was kept almost entirely in his room while staff administered medication to him. We were told that he had been awake for much of the previous month and had become increasingly aggressive during that time. He also hadn't admitted himself voluntarily. By the end of that first week, his behavior had become extremely unpredictable. He would spend long periods pacing around the ward, sometimes trying to force his way through the locked doors. Other times, he would stand in the communal area arguing with his own reflection in the glass panels. Eventually, he started approaching other patients and accusing them of being part of whatever was happening inside his delusions. One night, I was making toast when he suddenly came up behind me. He was making strange, angry noises, and I completely froze. I remember standing there terrified and hoping the nurses could see what was happening and would intervene. Thankfully, he eventually backed away from me and walked off. I immediately went back to my room. As the days went on, his behavior became so difficult to manage that the staff sometimes found it easier to put all of us in our rooms, rather than call security and additional staff to physically return him to his room whenever he became agitated. We learned to stay away from the small windows in our bedroom doors because we didn't want to attract his attention. By the end of his second week of chaos, I was finished with my own treatment and left the hospital. Several years passed. Then, shortly before Christmas, I was visiting my other mom at her house. At some point, she asked when I was planning to leave and whether I could give her stepson a ride to work on my way home. I said sure. Then I realized who her stepson was. It was the same man from the psychiatric ward. I hadn't recognized him years earlier because, during that period in the hospital, he had looked and behaved like an entirely different person. He had been so disconnected from reality and so difficult to manage that I could barely reconcile that version of him with the person standing in front of me now. I agreed to drive him. For the entire 30-minute trip, I was gripping the steering wheel with white knuckles. I was afraid the entire time, even though he was sitting there calmly and hadn't done anything threatening. He didn't remember me from the hospital, and I decided not to mention it. Thankfully, he was doing much better by then. That short drive was strange because I was sitting beside someone I remembered as one of the most frightening people I had ever encountered. Yet this time he was simply a person on his way to work.